trachea, I know. Okay, trachea is right here. And it's that ribbed structure. Yep, you can feel the ribs. That's cartilage rings. Now, directly behind this is going to be the esophagus, but it's directly behind. So, I mean, we haven't weeded all our tissue away, so, but I'll just try to find it real fast. That flattened tube, that's the esophagus, which is going to go the whole way down to the stomach. And then trachea lies directly on top.
Of the esophagus.
Yes, exactly, of the esophagus. Okay, so then you're going to expose your heart. Obviously, these are our lobes of our lung.
So it's upper and lower lung?
Yeah, well, you have several lobes, but you don't worry about that.
Okay.
We'll do that in humans when we get to respiratory system. Don't even worry about it. Just know it's lungs, that's all. Okay, then you get to your diaphragm, which is this flattened organ that's used in inspiration, which is breathing in.
Okay. So it goes down when you inhale?
Well, it actually lifts up a bit.
Okay.
But again, yeah, well, and I'll get into exactly how that goes. But it opens up the thoracic cavity too. Okay, now right underneath this, now we're abdominopelvic cavity. So this is all the liver. You see that gallbladder, green.
The gallbladder is within the liver?
Yep.
Wow.
Because the gallbladder makes bile, but then sends the bile. The liver makes the bile, sends the bile to the gallbladder to be stored. So it's going to look green. That's because, remember, the bilirubin, greenish pigment? Okay, now we go underneath it. This is just some extra tissue. So I may at times pull that off, but you want to make sure you're careful about it. This is stomach.
So right underneath the liver is the stomach.
Exactly. Now, all of this was your greater omentum.
That holds everything in.
Well, it's more for protection because remember you don't have any bony protection here.
Like the ribs protect the heart?
Exactly. Yeah, so this is the best you got because there's no bones. So greater omentum. Again, I don't care if you remove it or maybe you just want to kind of tuck it away because you do have to know it. You might want to remember where it's at.
The only thing it is just for protection. And it's attached to the stomach.
Well, yes, at the bottom part of it, and then it's also attached to the pancreas too. So if you want to see pancreas, lift up the stomach. Stomach goes up, and it's this right here. It looks like a piece of chewed up meat.
Oh wow! So you go
all
liver,
of that.
stomach, pancreas.
Yes, that's all pancreas. Okay, so you lift up the stomach, and now you can see it between stomach and small intestine.
So all this is small intestine?
Yes. Okay, before we get there though, see this? This is spleen. Only on the left side. Only on the left side. So it sits right there. Okay, now let's go and look. After the stomach. So stomach, and then you go into the small intestine. So this is actually the first part of the small intestine, which is the duodenum. Okay? And then all of this in the middle is all small intestine, yes. This is all small intestine.
What is that?
Okay, that's a vein.
Okay.
This clear stuff is the mesentery that you can see. Now, as you were asking about, there's arteries and veins in here. The red lines are obviously arteries. The yellow lines are veins. Now, why are they yellow and not blue? Because they are part of the hepatic portal system, which comes from the liver, which I'll explain later.
Okay.
But they're arteries and veins. Now, to find large intestine, it's easiest to go from the end, the rectum area, and follow it backward. So what I do is I start at the end, rectum's way down there.
So that's not the horn?
Oh, yes.
Okay, good.
That is, but I'll do that later. Okay, so I'm going to follow it, and it comes around, and then you're going to see it's this little, like the little knob. Mm-hmm. That's the beginning of it.
So is this whole thing?
This whole thing is large intestine.
Okay.
Now you need to know the parts of the large intestine. So it begins with this knob. You see that?
Uh-huh.
Yep, the knob.
Oh, right here, this little flat piece?
Exactly, and it lays like right there. So this is cecum. Again, this is all part of the large intestine, but you have to be more specific. Well, it's the very first part of the intestine.
Okay.
Large intestine. So this is cecum, where the knob is. And then it goes ascending colon, transverse colon, descending colon, and then where it kind of does a little turn, that's called the sigmoid colon. And that's all the parts of the large intestine. But you have to be specific and know them.
Does the small intestine have parts like that too?
Yes, it has the first part, which find your stomach, and then see where it connects. This is called the duodenum or duodenum. and then it goes into jejunum, but you're not going to be able to see where that starts. I can't even tell that. And then the last part is the ileum. Now I know where the ileum is because it connects with the cecum. Ileum is the last part of the small intestine.
Oh.
So this would be, I know that's ileum only because I can see here's where the large intestine.
Right, right.
Can you tell where the jejunum, which is the middle part, begins and ends? No, I can't tell that.
Okay. 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 Cool.
So you can only tell the beginning and the end of the small intestine, to be honest with you.
But you have to lift up the small intestine to find the starting part of the large intestine.
That's what I do because it's easiest to go backward, and then you can. It's easier to find that little knob if you go back from the backward. But hey, if you find it first, don't worry about it. All right, now this is your bladder. That sac is your bladder. You just have a bunch of adipose tissue surrounding it, which you don't need. That's all the yellow stuff anyway. Okay, bladder here. Now, attached to the bladder will be the ureters or ureters, which connect to the kidney. But this is going to take a little time because you have to weed away all this tissue and follow them to the kidney. Now, the kidney.
That's the kidney
Yes,
right there?
you have to lift all this stuff up. You got one over here and one back here.
Right here? That's the kidney?
Yes, but you have to get in there
It's going to be
and expose it. Yes. So again, I'm going a little bit faster, but you can take your time so you don't cut anything.
Even that pink thing you can take off?
Yeah. Yes. And that's going to show you the blue like I had on my picture. At least if they dyed it properly. Oh, now for you, I only see some of the veins going through, but that's it. See that? Mm-hmm. Yep, that's the kidney. And so what you're going to keep doing, like exposing the vessels, again, is do that little technique. Beside them and go out. And so I just exposed the renal vein that went to the kidney. Now, I was actually looking for ureter. So right here's the ureter, but you have to weed away a bunch of tissue to see where it connects to the bladder. Okay, so I'm going to let you do that, and it's a real thin tube, which is very delicate, so just be careful.
Where are the horns at, though, real quick? Is these whole things the horns up here? These are the horns?
Oh, okay, yep, hold on, we're 1 second. Okay, yes, so since you have a female, where it joins, that part is the uterus. And then the uterus separates into the uterine horns.
So babies are in here?
Yes.
Okay.
That's where they develop. And then it gets to the ovary, which is just looks like a tiny little bean. It's just this little thing right there.
Oh, wow.
That's
the whole
it.
thing?
Yeah, that's it. That little bean. That's the ovary. Okay, so you can also, right there it is on that side. That's it. So you can follow that and check it out.
Cool.
Okay, so now we have all of the organs. The next thing you have to do is, again, it's very time consuming, but you're just going to try to expose the descending aorta, expose the inferior vena cava. All right, now right now, I've exposed, you see this red line right here?
What red line? Right there.
Yeah, I can expose it a little bit better. It just takes a little bit of time. That is the inferior mesenteric artery. Try not to cut that because you need it. And it's going to connect. There, you're starting to see a little better?
Yeah.
Okay, that red line? That connects to the descending aorta. You have an inferior mesenteric that connects to the large intestine. Okay, later we have a superior, but that's going to take a while till we can get to that. Okay. And again, just keep doing your exposing.
This is it, right? This is it.
Right here. Trying to at least show you the descending aorta.
That the whole blue line right there?
No, that's in, inferior vena cava. Here's the descending aorta. Yeah, so eventually you're going to expose all of this.
They sit right on top of each other?
Yeah, like it's almost, especially at the bottom here, like the artery aorta is kind of on top of the inferior vena cava. Okay, but you see what I mean? You just have to keep doing this very carefully. Eventually, you need to get down to this bottom part down here, because this is where the iliacs are. Okay, now I just exposed it here. Here's one you need, the lumbar or iliolumbar. It just takes a while, you know what I mean? That's all.
That line right there?
Yeah, it's starting to come out, starting to come out. That's the iliac.
You want to be a veterinarian?
I used to want to be an equine surgeon, but then I did everything you're supposed to do to get into vet school.
You changed your mind?
And I changed my mind. You got to do it to know. I was doing cats, dogs. I was doing horses. I was doing livestock, large animal. I did everything.
You just didn't like it anymore?
I shadowed everybody. I loved animals, but when you're a vet, it's more than just like, the animals don't usually like you. They want to bite and scratch you because they don't understand.
Right.
And so that's when I decided, my junior year of undergrad, that I had a couple professors that I was like, became my mentors, and I'm like, this is what I want. That's what I want. Yep. Because I was tutoring too, and I just liked it. Okay, this is iliolumbar, artery and vein. That's one you need. Okay, now you see descending aorta becomes, there's no common like we have. It immediately becomes right and left good. External carotid, external iliac. And then the internal iliacs, right and left, are here. See those internal branches? Okay, so that's one of the things you want to find. Now, eventually, you want to get up here. Then you're also going to have to. Oh, good. Oh, okay. Oh, here. We got some exposure here. Just keep working away tissue. Okay, and you just have to keep doing that for.